10 weird vitamin D deficiency symptoms that you should never ignore. Vitamin D is widely recognized for its crucial role in maintaining bone health. But did you know that a lack of vitamin D during pregnancy might also influence the likelihood of newborns developing asthma? Asthma affects millions worldwide and remains a mystery in terms of its causes. Despite this, researchers in the United States are investigating how ensuring adequate vitamin D levels during pregnancy could serve as a preventative measure against asthma in children. A study published in the American Journal of Health Economics suggests that women who get more sun exposure during the second trimester of pregnancy reduce the chances of their children developing asthma by up to 23%. Vitamin D plays a crucial role in regulating bone metabolism and is essential for the body's concentrations of calcium and phosphorus. It also functions similarly to a hormone. Every cell in the body has a receptor for vitamin D, underlining its universal importance. Studies also indicate that adequate levels of vitamin D in the body can reduce the chances of developing chronic diseases, such as high blood pressure, diabetes, obesity, and various types of cancer, including breast cancer. Vitamin D deficiency is more common than one might think, affecting approximately 1 billion people worldwide. In the United States alone, approximately 42% of adults are deficient in this essential nutrient. But what few people know is that vitamin D deficiency in the body can have serious health consequences, and believe me, it goes way beyond bone problems. In this video, we will highlight 10 weird vitamin D deficiency symptoms that you should never ignore and explore why ensuring adequate levels of this vitamin is vital for overall health and well-being. Pay close attention, as the signs of vitamin D deficiency we're about to discuss are not only crucial, but may also be unexpected. One of these symptoms, in particular, might be surprising and could require immediate medical attention. Symptom number 1. You feel tired all the time. Feeling constantly tired, even when engaging in simple daily activities, is a notable sign of low vitamin D levels in the body. This fatigue is often accompanied by a sense of exhaustion and shortness of breath. It occurs because insufficient vitamin D leads to lower levels of calcium and phosphorus, essential minerals for efficient metabolic functioning. Therefore, experiencing excessive tiredness while performing tasks that are not physically or mentally demanding could be a clear indicator of vitamin D deficiency. 2. Your hair is falling out frequently. While stress is a well-known factor contributing to hair loss, severe hair shedding may also indicate underlying medical conditions or nutritional deficiencies. Particularly in women, there is an observed correlation between hair loss and low levels of vitamin D, though research in this area remains limited. Moreover, alopecia areata, an autoimmune condition characterized by significant hair loss, has been linked to rickets. Rickets, primarily caused by vitamin D deficiency, leads to the weakening of bones. 3. You have mood disorders and depression. Recent research from Ireland, published in the Journal of Post-Acute and Long-Term Care Medicine, reveals a significant finding. Vitamin D deficiency may increase the risk of depression by as much as 75% in individuals over 50 years of age. This correlation arises because vitamin D plays a vital role in the proper functioning of the body, particularly in the brain. Neuroreceptors, which are crucial for brain communication and mood regulation, rely heavily on sufficient vitamin D levels. Inadequate vitamin D can impair the efficiency of these brain messengers, potentially leading to mood disorders like bipolar disorder and depression. Moreover, other serious conditions, such as schizophrenia and alcoholism, have also been linked to low levels of 25-hydroxyvitamin D, calcidiol, the primary storage form of vitamin D in the human body. After sunlight exposure or consuming foods rich in vitamin D, the liver converts vitamin D into 25-hydroxyvitamin D. This conversion is extremely essential for mental health regulation. Bipolar disorder, a complex mood disorder characterized by alternating periods of depression and euphoria, mania, varies in intensity and impact. Understanding its biochemical underpinnings has been a focus of recent research. Scientists at a research center in Oakland, California, have uncovered a vital link between vitamin D and omega-3 fatty acids in promoting mental well-being. According to their findings, these substances are crucial in regulating serotonin production, a key hormone influencing mood, decision-making, and social behavior. 4. You suffer from dizziness, vertigo. Have you ever felt a sudden sensation of spinning or movement, either of yourself or your surroundings, upon moving your head? This condition is known as benign paroxysmal positional vertigo. It's a common form of vertigo where slight changes in head position trigger a disproportionate sense of motion. Studies have suggested a potential link between lowered levels of vitamin D and the onset of BPPV episodes. This connection is particularly significant, considering the role of vitamin D in bone health and calcium regulation, which are crucial for the vestibular system's function. The vestibular system is vital for maintaining balance and spatial orientation. A recent publication by the American Academy of Neurology highlights that supplementing with vitamin D and calcium could be a straightforward and low-risk strategy to prevent disorders related to the vestibular system. This approach suggests a promising avenue for those suffering from vertigo, offering a simple method to potentially alleviate these disorienting episodes. Additionally, vitamin D plays a role in bone health, and changes in the bone structure of the inner ear can affect stability, triggering vertigo and dizziness. 5. You have an irregular heart rhythm, arrhythmia. Vitamin D goes beyond and plays an important role in cardiovascular health. The cardiovascular system relies on adequate levels of calcium and phosphorus for optimal functioning, and vitamin D plays a crucial role in regulating these minerals. Consequently, vitamin D is instrumental in influencing the contractions of the heart muscle. Its deficiency can directly impair the heart's ability to pump blood efficiently, potentially leading to arrhythmia or irregular heart rhythm. Ensuring adequate vitamin D intake could therefore be a key factor in preventing or managing arrhythmia, further highlighting the vitamin's multifaceted role in maintaining overall health and well-being. 6. You get sick frequently, respiratory system infections. One of the most important roles of vitamin D is to strengthen the immune system, activating defense cells such as lymphocytes, enabling them to effectively combat viruses and bacteria responsible for various diseases. If you get sick frequently, especially with colds or the flu, low levels of vitamin D may be a significant contributing factor. This connection is substantiated by numerous studies demonstrating a correlation between vitamin D deficiency and an increased incidence of respiratory tract infections, including colds, bronchitis, asthma, and pneumonia. 7. You have skin health issues. A deficiency in vitamin D can negatively affect skin health, being known as the beauty vitamin, due to its impact on the appearance and vitality of the skin. A lack of sufficient vitamin D can lead to decreased collagen production, a critical protein responsible for maintaining skin elasticity and firmness. This reduction in collagen can result in the appearance of wrinkles, fine lines, and sagging, contributing to premature aging of the skin. Moreover, vitamin D deficiency is associated with issues like dry skin, making it rough and lackluster. It can also increase the propensity for skin conditions such as acne, eczema, and psoriasis. Before we move on to the last symptoms, please consider liking this video if you're finding this information valuable. Subscribe to our channel and hit the notifications bell to be the first to know when we release new exclusive videos. 8. You have nightmares at night. The absence of vitamin D in the body can significantly disrupt hormone production, including melatonin, which is integral to regulating the sleep cycle. This disruption can manifest as various sleep-related issues: difficulty in falling asleep, frequent waking up during the night, experiencing nightmares, and often not feeling sufficiently rested. While these problems might seem minor initially, they should not be underestimated. Over the medium and long term, poor sleep quality can escalate the risk of developing serious health conditions, such as cardiovascular diseases and diabetes. 9. You experience bone loss and muscle mass loss, sarcopenia. One of the most critical symptoms of vitamin D deficiency is the loss of bone and muscle mass, a condition known as sarcopenia. Vitamin D is essential for the body's proper absorption of calcium from food. Its deficiency not only increases the risk of osteoporosis and fractures, but also significantly elevates the likelihood of muscle loss, which studies from the Federal University of São Carlos in Brazil and University College London have quantified as up to a 78% increase. The deficiency impairs the absorption of essential minerals and is linked to reduced bone mineral density. This, in turn, leads to diminished muscle mass, strength, and function. Elderly individuals are particularly vulnerable to vitamin D deficiency due to factors like decreased dietary intake and less exposure to ultraviolet radiation. As a result, they face an elevated risk of developing sarcopenia. This highlights the importance of maintaining adequate vitamin D levels, especially in older adults, to prevent or mitigate these debilitating effects on muscle and bone health. 10. Impaired wound healing. Problems with wound healing are notably prevalent in diabetic individuals, but are also closely associated with vitamin D deficiency, which stimulates the production of compounds essential for new tissue formation, a vital process in healing. A study focusing on patients undergoing dental surgeries has revealed that a deficiency in this vitamin can significantly impair the healing process. Furthermore, vitamin D is instrumental in controlling inflammation and bolstering resistance to infections. In cases like diabetes-related foot infections, severe vitamin D deficiency has been linked with heightened inflammatory markers, signifying more substantial challenges in the healing process. In addition to recognizing the various symptoms of vitamin D deficiency, understanding the appropriate daily intake of this vitamin is crucial for maintaining health. The National Institutes of Health recommends a daily intake of approximately 600 IU, 15 mcg of vitamin D for individuals up to 70 years old. For those over 70, the advised intake increases to 800 IU, 20 mcg per day. This difference in recommendations is based on the changing needs of the body with age. Levels falling below these recommended intakes can lead to the symptoms discussed earlier. However, it's equally important to be aware that excessively high levels of vitamin D can also pose health risks, causing issues such as calcium buildup throughout the body, especially in the kidneys, blood vessels, lungs, and heart. There are three main ways to effectively increase vitamin D levels in the body: through sunlight exposure, dietary intake, and supplements. Sunlight is the most significant source, accounting for about 90% of the vitamin D our bodies need. The ultraviolet rays from the sun trigger the conversion of chemicals in our skin into vitamin D3. For adequate synthesis, it's recommended to expose your back and torso to sunlight for about 15 to 20 minutes daily. The importance of sun exposure in vitamin D production is unquestionable, but some people are more prone to deficiency, especially without supplementation. Office workers and professionals with limited sun exposure, such as shift workers and healthcare workers, are at a higher risk for vitamin D deficiency. Individuals with darker skin are also more prone to deficiency due to melanin's ability to absorb UV radiation, which decreases the skin's capacity to produce vitamin D. Consequently, they may require longer sun exposure to maintain adequate levels. Dietary sources also contribute to vitamin D intake. Foods rich in this vitamin include milk, egg yolks, mushrooms, butter, and oily fish such as salmon, canned tuna, and canned sardines. However, it's important to note that relying solely on food may not provide sufficient levels of vitamin D. Another way is to use supplements, but always under medical guidance to avoid problems due to excessive consumption. Taking supplements can be a reliable way to ensure adequate intake, especially when sun exposure and diet are insufficient. Balancing these three sources is key to maintaining optimal vitamin D levels for overall health and well-being. Please understand that this video is for educational purposes only. If you're facing health issues, always consult a medical professional for a comprehensive evaluation and appropriate advice. We hope you found this information helpful. If so, give it a thumbs up and consider sharing this information with your loved ones. Now, we'd like to hear from you. Are you suffering from any of these symptoms of vitamin D deficiency? Let us know in the comments below. Before you leave, I highly recommend you to watch 2 additional videos popping on your screen right now. You will certainly find them interesting too. Thank you for watching. Until next time, bye.